Hello, good afternoon. My name is Judy Brown, and I'm in Nursing 5382, and we are doing a mock video. I'm actually interviewing the governor. Hello, Governor. I wanted to talk to you today about the maternal mortality crisis that we're facing in our nation. The number of maternal deaths in the nation is on the rise. In 2015, 25 maternal deaths have occurred per 100,000 births. That's mothers that are dying from complications related to pregnancy or childbirth here in the United States. Yet, in countries like Canada and the UK, the numbers are declining. They're in single digits. State-wise, California has shown a little bit of a decline, but in Texas, as you're well aware, the rates continue to significantly increase. In fact, from 2011 to 2014, they've doubled. What do you think about this and how it's affecting your great state of Texas?
Currently in Texas, there is a task force underway that is studying pregnancy-related deaths. The Texas legislature passed legislation listing levels of maternity care, and in 2020, hospitals will need to designate their levels of maternal care.
Yes, the Department of State Health Services created the Maternal Mortality and Morbidity Task Force by Senate Bill 495. This task force reviews cases of pregnancy-related deaths and then makes recommendations to help reduce the incidence of pregnancy-related deaths in Texas. As a maternal health care leader in Texas, this is of great concern to me. There's a significant lack of data to tell us why maternal mortality is increasing. Could it be related to the lack of preventative care or the growing disparities that we're seeing?
Disparities do exist in maternal mortality, as they do in any other areas of healthcare. The increases are most noticeable in African American women. The numbers of deaths per 100,000 live birth among Black women is more than 3 times higher than in white women. The task force was created to take a deeper dive into these disparities.
This is very alarming. One has to wonder if it could be related to the growing prevalence of increasing conditions like obesity, diabetes, heart disease, or the opioid crisis that we're facing in the nation. This is more than a Texas problem. Bipartisan Bill 1318, which was formerly known as the Preventing Maternal Deaths Act, was introduced in the House in March of 2017, and then Trump actually passed it into law in December of 2018. This is the first step in addressing this crisis.
Do you think this will help?
It is the first step in addressing the crisis on a national level, and will provide states resources to investigate and report every death. The bill further enables research by helping physicians develop a plan for education to improve quality. It will also help fund mortality review committees that can evaluate, improve, and standardize data. Significant research is needed to help identify why Black women are 3 to 4 times more likely to die of a pregnancy-related condition in this country, from preeclampsia, HELLP syndrome, or other hypertensive disorders. We need to continue the research and create the data and maintain transparency and help fund the research. Thank you so much for the opportunity today to talk to you, and thank you for helping create the task force in Texas.